Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome to Think Big with Dan and Qasim. And if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Absolutely. My name is Harlon Pickett. I am the president of Eagle Care Health Solutions. We are located in San Antonio, Texas. We help small businesses and individuals navigate the crazy world of healthcare and health insurance. We also provide alternatives to traditional health insurance that actually provide true access to health care, because health care and health insurance are not the same thing.
Awesome. So how did you get the idea to start this company?
Well, I've been a traditional insurance broker for a number of years. Saw the problems inherent in the system, mostly because of problems that clients have. Whenever you see people that cannot afford their deductible, when you see people that end up, that you believe you've done a great job of putting them in the plan that fits them best, right? Has a great deductible maybe for them, has the plan is designed is exactly what they wanted. And then they end up with huge medical bills and potentially in bankruptcy because of the medical bills that they have, and they had insurance. You start asking yourself questions. What am I doing? What am I doing wrong? How did I let my client get in this situation? Because that's not a good feeling, right? The client, typically they're not blaming you, but they're wondering what happened as well. So when you see this happen enough times, Dan, you finally say, okay, what can we do different? And what I really came to realize after almost 20 years in this industry was that this is not a popular opinion. It's getting more and more that way, but the insurance companies are not your friend. They're for-profit companies, and that's what they're there for, is to make a profit. And therefore, they deny claims because it's beneficial to them. They approve them because they're beneficial for them. And here's a little crazy deal. Nowadays, they actually want the price of healthcare to increase. That is how they actually make more money. If the price of healthcare increases, they're able to charge higher premiums. They charge higher premiums, they make more profit. So they're not there to be your friend. And we've seen lots of lawsuits here, especially in this last year, because of the Consolidated Appropriations Act that make businesses now the fiduciary. They always have been. They're really putting a spotlight on it now. And because of that, we're seeing more and more people say, hey, what are you doing with my money? Because it is. I mean, whose money is it, right, Dan? Whose money is it? I'm the one paying the premiums. It's actually my money. But we have this crazy thing in the United States where we have this middleman that determines which doctors we get to see and which services we get to have, depending on what they feel is right for us, not on any type of true medical opinion, but really what's going to make them money. So, as I started uncovering these things, I said, okay, there's got to be a better way. I didn't know nothing about building anything. I'm just an insurance guy, but I was challenged by a good friend of mine to do something about it, stop talking about it and start doing something about it. Thus the birth of Eagle Care Health Solutions, and a long journey to put together options for individuals and companies that knock the traditional model out of the way and actually provide true access, in many cases, direct access to healthcare and healthcare providers.
Awesome. So can you just give me an example of like an ideal customer, or even like a customer who's using you guys today, without mentioning the customer name, but like just a use case for audience to get a better idea?
Yeah, absolutely. So we have a group. I'll use a brand new group that we have right now in Illinois. We're down here in Texas. This group's in Illinois. They heard about what we were offering. We do like to build our plans, if possible, around direct primary care. Direct primary care is a model that is not our traditional fee for service. It is a monthly fee that you pay. It's basically a membership. So you pay this membership and you can go see that doctor as often as you want to. When you have this relationship with that doctor, you have something interesting, a relationship with a doctor. Wow, what a crazy thought process, right? Because that's what we're missing now. You wait weeks, if not months, to see a doctor. You spend an hour in the waiting room, all to spend 5 minutes with your doctor. And all that doctor does then is send you on to a different doctor by referral, or just write you another prescription. That's never going to get you where you want to be in the world of health. So direct primary care flips that around. You get 30, 45 minutes, even an hour with your doctor. You get your doctor's phone number. You have your doctor checking in on you. You have that relationship with your doctor again that we heard about from our parents or grandparents, that we may even, some of us that are old enough, remember having that family doctor when we were kids. We didn't necessarily have a pediatrician because the doctor can actually take care of everybody. And so this group saw the need for that. He had stopped providing insurance for his, or offering insurance to his employees a number of years ago because of the high cost that was associated with it ever since Obamacare came into play. And he loved the thought of going a different direction, still having the protection of high cost that a medical cost sharing plan that we have offers. He loved the fact that people could have direct primary care, which direct primary care takes care of anywhere from 80 to 90% of your regular healthcare needs, and having a healthier staff. And that's really the thought behind this. We have a number of companies in Houston, Texas, in San Antonio, in Austin, that are using this same process because we have a contract with a group called Next Level Urgent Care, where we offer their Prime membership to smaller groups. They have offered that for years to large groups, but through Eagle Care, we're offering it to small groups, even down to individuals that want access, unlimited access to health care without that middleman insurance company deciding who you can go to. So for only $80 a month, Dan, $80 a month for your entire family, you can have a membership through Eagle Care to all of the facilities they have in Houston, San Antonio, and Austin. That's over 40 facilities, 9 a.m. to 9 p.m., 7 days a week. You can visit those at zero copay and zero out of pocket. Whatever happens there, you're going to be taken care of 100%. And that also includes your virtual care and your behavioral health. So that turns things on its head right there, right? You're not paying high premiums to an insurance company and never seeing a return on that investment. You're seeing people that truly have access to health care now because we took that middleman out.
That's amazing. So what would you say is like the biggest challenge that you currently face in your business?
Without a doubt, it's getting people over the concept that they have to have insurance. People truly believe that they have to have insurance. It's so prevalent in our country that even the place you buy health insurance as an individual is called healthcare.gov. Think about that. Healthcare.gov, you buy your health insurance plan, and there is not one iota of healthcare that can be purchased on healthcare.gov. All you can get is an insurance plan that in many cases provides a barrier. I mean, can you imagine if you had a bronze plan there now, which is what usually people get for the zero cost? Man, I got a zero cost plan. What's your deductible? $9,400. Most people don't even have $400 in the bank. And if I got a $9,400 plan, do I really even have insurance then? Do I really have anything that's going to help me? I'm just going to say right now, you don't. Right. And that's the tough thing, is getting that mentality that health insurance and healthcare are two separate things, and you can get healthcare without health insurance. In fact, it's much better. It's a whole different experience whenever you don't have that. So that's the biggest challenge that we face without a doubt, Dan.
So how do you like overcome that obstacle? How do you get in front of new customers or potential customers and say, hey, like, this is what we do, you should make the change? Like, what has been your strategy so far in terms of marketing?
When people ask, who is your perfect customer? Who is a perfect referral for you? Somebody that's pissed off. I mean, that's what it is. It's kind of funny. Someone who is just done with the system. They're done with the rate increases every single year. They've come to the realization that they are no longer paying for healthcare. They're paying for this big behemoth who upcharge them all the time. And everything keeps going up and up and up, and they feel like they have no control. And so when we come in and we talk to those folks, the work's kind of already done because they're really looking for something else. But we've got to do something very interesting. This is kind of crazy because insurance people don't do this. Because if you're in the traditional system and you do traditional plans, the question you really ask them is, well, what deductible do you want? And do you have a preference of which company? So that's not really asking them the question, because all health insurance plan does is provide a healthcare supply chain of services, all the way from who processes your claims, to who provides your medications, to who does your navigation of which doctors that you're going to see, which network do you use. There's just different pieces that are all brought together that are part of the healthcare supply chain. But businesses don't look at it that way. Even businesses that work in supply chain all the time, they don't think about it that way. And because they don't think about it, when we bring this concept to them, they're like, that light bulb goes off. And they're like, wait a second. When we're going through, we control our supply chain, and so we can control the cost. You're telling me we can control our healthcare cost? That's exactly what I'm telling you. So I am promising you we can control your healthcare costs, so much so that we put our compensation on the line. We do not get paid by anyone in that supply chain. The only person we ever get paid from is the employer themselves. So we consult with them on how to put that together. We ask them this crazy question: what do you want? What do you want your healthcare plan to do? What do your employees want? What's missing now? Well, typically there's a lot missing now. There's a lot of, there's no relationship with doctors. There's long waits. There's soaring cost. So we start sometimes with just very small little pieces that we start putting together, because different groups, what we call it is noise. So whenever you start changing plans around, the employees cause noise. Their displeasure so they hated what they had until you changed it. Then all of a sudden they're reminiscent about how good the old thing was. Why? Because it's not the new thing. It was the old thing. I understood it. People are really not afraid of change as much as they're afraid of something they don't understand. And so it's really our job then to engage with them and educate them what the differences are and why this is going to be better and how it's going to work better. You're never going to make everyone happy, but what we have noticed is over a 2 or 3 year period of time, the whole group changes dramatically. We see healthier folks overall. We see the cost the cost of the health plan just goes down every single year. The way people are now consuming healthcare is a lot more like what they would consume anything else, because in healthcare, we don't ask prices, right? We don't know what anything costs. There's this big push for transparency, but I promise these guys have got this figured out. You're never going to know the real cost as long as you're working through insurance. But there's always a cash price, and there's always direct contracts that have negotiated prices where they cannot charge you more than a certain amount. And when you go down that path, as we build your healthcare supply chain, it changes the dynamic. You are now in control instead of you hiring someone, one of the big insurance companies, to be in control. Because if they're in control, remember what I said earlier, they're not your friend. Their goal is not to help you and your business. Their goal is to help themselves. And they're going to do whatever it takes to help themselves. They're not on your side of the table. That's where we change things. We sit on your side of the table, because if the plan doesn't work the way we promise and guarantee it's going to work, we don't get paid. And we wouldn't last very long if that was the case, if we weren't living up to the expectations of the plan.
No, yeah. I mean, I obviously see the value in what you're doing. But I was just curious more so, like, how are you getting in front of your, prospects or new, like, is it just, do you do like cold emails? Do you run ads, cold call, conferences? Like, what has worked for you thus far to actually grow this business?
Yeah, that's a great question. And conferences are one of the things. You go to some of the conferences that are where people are doing things a little bit differently. You're going to see employers that are curious about what's going on in those areas. We don't do big email pushes per se, but we do join and go and speak at chambers of commerce. We speak at conferences. We speak at different business groups around the country where we're bringing these novel ideas out there. And when you throw stuff like this out to a bunch of people, especially if they're CEOs and CFOs in the audience, and they're hearing for the very first time that they may be able to control the cost of healthcare in their company, which is the second or third largest line on their profit loss, they want to know more. They're curious. Okay. That doesn't mean they're ready for a change, but it means they're curious. There's times that some of these cycles are 3 or 4 years before you finally have someone that's willing to make that change. Once again, we have this thing in this country where we just depend on insurance companies to provide us access to healthcare. And there's companies that just have to get past that. They have to understand what's really out there and that they truly have control. It's such a novel idea that you can control your healthcare costs for a big company. It takes a lot of people to understand. It's really easier, kind of funny deal. It's really easier on smaller companies. If they're less than 100 employees, and particularly if they're less than 50, they're much more open because that cost of healthcare is eating them up. I mean, it's hurting their business. And in many cases, they just won't offer anything, or like the guys that we just helped in Illinois, they just stopped doing it. they just stopped and said, sorry, guys, there's nothing we can do for you. It's just too expensive.
Right. No, for sure. And or even like, newer companies like ours, who haven't even offered that yet, but it's something that
Right.
before, like, it's a great opportunity there because they haven't even started. So it's like that when they're looking to start, it's like, okay, I'm going to go with the better option, a more cost-effective option. It's much more valuable. So obviously now that we're wrapping up 2023, so for 2024, like what are some of your goals in terms of even like revenue, just increase? You can mention percentages, I guess, like what would be a successful year from this year to next year for you?
That's a great question, and it's a funny way to look at it, but we really look at it not as income or as percentages, but in membership.
Okay.
Okay, so our goal for 2024 is to add a minimum of 5,000 new members, and that is a realistic goal for us. We would certainly like to even do better than that, but there's two different goals there. Okay, we want to increase our membership by 5,000. Now, it's actually a bigger number than that because we're talking about 5,000 members. And then if they have families, and that's additional. But we're talking about an actual membership is the primary person. So whether that's an individual or a family of 10, that's one. So lives would be higher than that, but 5,000 is our goal. But then there's another overall goal that we have, and that's to help 1 million people. Okay. Now that help 1 million people, that is a 5-year goal that we started last year. And that help 1 million people is not have 1 million members. That'd be great. Let me not say that I wouldn't like 1 million members, but what it really means is make an impact in 1 million people's lives and helping them understand that they have a different way to access healthcare. If we can do that by reaching 1 million people and helping them change the way they're accessing healthcare, we've made a huge accomplishment. That's almost impossible to track, right? Because we don't know the people that may listen to this podcast and say, wow, there is a better way. Let me look and see if I have a local DPC. I think that membership idea is great. I'm tired of waiting 4 months to see my doctor. And they make that change. It's just an overall, it's a reason I do that. This podcast, it's a reason I have my own podcast. It's a reason, I've been blessed to get to be asked on television shows to have little segments about this stuff. It's the reason I do those things. It is definitely not self-promotion. It is helping people understand the problems that are out here right now and the solutions as well. We're not the only solution, in other words. You can certainly take baby steps. We would love to help you. We'd love to talk to you, whether you're a broker looking to offer options or whether you're an individual or a company owner looking to look at stuff differently. We'd love to talk to you. But really, our primary goal across the next 4 years, including 2024, is helping 1 million people get true access to healthcare by helping them change their thinking. But it's an interesting way. We look at things a little bit differently. It's not all about revenue for us.
Right. Well, I guess like
obviously important,
so like
but helping people is why we started.
100%. So how many members do you have right now?
We're a little over 2,700 right now members that we're going to end the year on that. We'll be a little bit higher than that, probably. We have some that are closing in right now, and we just run a big thing. The deadline to enroll for a 1-1 is today, and we've had a lot of stuff processing right now because of a little thing that we put out. That appearance on TV was yesterday that I just had, and so we have generated quite a bit of interest. So I don't know exactly where our number is going to be, but we're going to be probably just under 3,000 members for this year. And we've been on this particular plan. We do have some membership from a past, I guess you can say, iteration relationship we had with another group before this that we have about 50,000 members there, but they don't count as our members. So there are some of those that will probably transfer into our group eventually. But since we really started our own thing outside of anyone else, we're almost to 3,000 now and feel like we got a lot of momentum going with what we're doing. And we can have 5,000 more easily by the end of next year.
So what do you think is the biggest obstacle from where you're at now to getting those 5,000 more members by the end of 2024?
Getting people to move off center. And that's, once again, it's education, but that's always been, and this is also another interesting one, getting them to get off center. This is the biggest thing that we hear, especially about the $80 a month for the whole family, is that's just too good to be true. There's some kind of catch there. There's no way you're really offering that. Right? And so when you hear those things, that's difficult to overcome, right?
Right.
If someone's already got in their mind it's too good to be true, but it's based on what they know in their current system.
Correct.
I was asked on that television interview, can we fix our healthcare system? Can we fix it? And I said, it's not broken. And it's not broken. Have you not looked out there and see what's going on? Like, no, it's working exactly the way it was designed to work by the people that designed it to work that way. But what we've got to do is build a parallel system that works the way we want it to, that works the way it should,
Right,
a free
exactly.
market system. And if we got a free market system where it's supply and demand, then it's going to change everything. It's the same kind of system we have for almost everything else in this country, except for healthcare. Right. So while we build this, that's part of our challenge. And luckily, we're not in it alone. There's a lot of folks out there doing this. For any of your listeners, you want to see a huge group that's out there doing this, go check out the Free Market Medical Association at fmma.org. We're proud members of that organization. You can learn a whole lot about what's going on in this country in the free market realm and find out what's close to you to see what's out there too. But that's a great organization. But that is the biggest challenge, without a doubt, Dan, is getting people to realize it's real. This is real. Right. You can truly have healthcare access at a fraction of the cost of what you're paying now for health insurance.
Right. So obviously now everybody's looking for the best use case for high-level technology like AI in their business. So I was curious, do you guys use AI? And if not, like where could AI potentially come in and help Eagle Care Health Solutions?
Yeah, that's an interesting question, because one of the things that we have began using AI for is some of the underwriting that we do for groups. When you have a group, especially if they're under a certain size, well, really any size nowadays, it's very difficult if you say, hey, I need an application from everybody. I don't care if it's a group of 5 or if it's a group of 500. You are not going to get medical applications from those folks. You're just not going to. And so one of the places that we've been able to very successfully implement AI is doing the underwriting. They can take a look at the claims history. They do a lot of other secret things out there that if you're in AI, you probably know about. I'm not going to tell you because it scared the Jesus out of a lot of you if you knew all the stuff they could find out about you. But they do that underwriting, that direction, and it gives them a pretty realistic view of what that group's going to look like over the next 12 months. And so we're able to set the rates on self-funded, level-funded plans based on that AI. I'm sure there's going to be a lot of other ways that we can do it. And we use it ourselves in some of our advertising copy, some of our videos. We even have some of our, this is kind of cool, some of our how-to videos are actually created by AI with an AI person talking, giving you the explanation of stuff. So it's not even a real lady or a real guy that's doing it. It's an AI model that is doing the explanation, which I thought that was kind of cool, kind of creepy too, but kind of cool.
That's awesome. So what would you say is like the one biggest piece of advice that you wish you knew before you started this company?
Man, that's tough. It's been a go out and look for other people that are doing what I was doing. When I first started doing this, I really felt like I was on a desert island. I did not know anybody else that was doing anything like this. Most of my compadres in the insurance world said, you are out of your dadgum mind. And while that may be true, that was irrelevant to this particular thing. And as I was introduced and found out about the Free Market Medical Association, Next Gen Benefits, Health Rosetta, some of these other organizations that are very forward thinking in the way that they're approaching this, and very client or patient centric. So building plans around the patient instead of building plans around the insurance company. Whenever I found those groups, I was stunned. I said, oh my gosh, I didn't even know I had a people, and these are my people. And it has truly, it's almost like I was going in slow motion, and I didn't even get to regular motion, Dan. I was all of a sudden 10 times speed, because I was talking to people that had faced some of the hurdles some of them that I hadn't even faced yet, but people that had already been down this road, sometimes for years, light years ahead of where I was. And most of them were pretty impressed that I'd done what I'd done already, because with no help whatsoever. But they showed me, Hey, you're trying to, in many cases, recreate the wheel. Stop. Here, look, we've already done some of these things. We already have good partners. Some of these folks are already vetted out. We know that they're on our side. And that made a huge difference in even what we have out right now. The products that we had then and the partnerships we had then, which is one of the reasons we have a very different way that we're designed right now, we're not set up to be nearly as free in the way that you could see doctors and the way that the services you got, because I didn't know that you could do what we can do now. I had no idea. And that was a beautiful thing. Meeting your tribe, and you never knew you had a tribe, and meeting your tribe, man, that was it. That was the deal that pushed us into Lightspeed.
That's awesome. So if somebody watching this wanted to reach out, do you mind sharing your company website or social media handles? I guess just best ways to get in contact with you.
Yeah, absolutely. They can reach us at eaglecarehealth.com. That's eaglecarehealth.com. They can also reach out to me on LinkedIn. Name is Harlon Pickett, Harlon Pickett. If you search Harlon Pickett on LinkedIn, you're only going to find one of me, so you won't have much trouble finding out where I'm at. You can email me at hpickett@eaglecarehealth.com as well. We're on Facebook, we're on Instagram, we're all over the place. If you search Eagle Care, you're gonna find us for sure. But that is really the best way to reach out and see what we can offer to you. Or if you just have questions, just want to hang out and ask more questions, say, what in the world are you really doing? Hey, I'd love to have that conversation with you.
Awesome. Well, Harlon, thank you so much for your time today, and we're rooting for you to a very successful 2024.
Thank you so much, Dan. Y'all as well. I really appreciate the opportunity, buddy.
Thank you. All right. Bye.